Welcome to the Renegade Health Boss podcast, where we push the boundaries of what's possible in health and wellness. I'm your host, Heather Gray, a certified functional diagnostic nutrition practitioner and certified bioenergetic practitioner. And each week we dive deep into the world of physical, mental, spiritual health, biohacking, relationships. But we're not just talking about the basics. I'm bringing you conversations with the true renegades, experts who are challenging the status quo in their fields, breaking barriers, and uncovering the real truth behind what it takes to live an incredible, joy-filled, and optimized life. If you're ready to step out of the ordinary and step into a life of extraordinary health and happiness, you're in the right place. Let's get started on this journey to becoming your own Renegade Health Boss. And before we jump in, let's hear a word from our sponsor.
Healthy drinking pure water is easy as the push of a button. Same thing with my hair doctor. Right now it's pissed off at me because I was doing my hair. So the fumes coming off me blow drying my hair is making it go overtime. But what a sense of just peace, of just looking over at it, knowing that it's doing its best to keep my hair the cleanest. This company is absolutely incredible. Third-party verified. They go above and beyond the standards of most other companies. Oh, there it goes. Look at that. Now my hair is clean. Make sure to go to my website, renegadehealthboss.com, go to the shop and get yours, or click the link below.
Hey there, welcome everybody to another amazing episode of the Lyme Boss podcast. I'm Heather Gray, aka the Lyme Boss. I'm a functional diagnostic nutrition practitioner. I know, it's a mouthful. And bioenergetic practitioner. And I like working with fast-paced professionals who have digestive issues, right? Brain fog, no energy, and they're sick of going from doctor to doctor to doctor, having them tell them that their labs look normal when they feel anything but normal, right? Could it be undiagnosed Lyme disease and mold? I know it was with me. And that's why I love to get to the bottom, to the root cause of some of these issues going on. And today is no different. Today's guest is no different. We're going to be diving deeper into chronic Lyme, and we'll get a little bit into long haulers as well, because that's something that really needs to be talked about. And actually, thank God, long haulers, because it's brought a little bit more attention to chronic Lyme to the surface. So I love it when awareness can be brought more out to the light. And that's why we have these conversations. But with no further ado, please, let's welcome Dr. Lambert to the show.
Okay. Thank you.
Thanks for having us. Most of my people will hear it in your voice. So where are you hailing from this morning? Where are you calling from?
So I live in Dublin, Ireland at the present time, but I'm originally Scottish and I qualified in America. So people are a bit confused by my accent. So it's a bit of everything. But my origins are Scottish born, moved to America, moved back to the UK. And I took a job in infectious disease about 18 years ago in Dublin, Ireland. And I've been there ever since, trying to move back to Scotland.
Okay. So how did you get going into Lyme? How are you talking about some of these more complex, controversial things that not a lot of other folks are talking about right now?
Well, I trained in America. I trained in upstate New York and Rochester, New York. I qualified in Michigan. I spent 6 years in Baltimore and Maryland. So I was kind of in Lyme endemic areas. So I saw Lyme patients, but didn't really think anything of it, and didn't go beyond the usual, thought process that most people have about Lyme disease. But when I moved back to the UK and over to Ireland, I get asked to see Lyme patients because nobody else was seeing them. And there's now about 30 infectious disease doctors total in Ireland. And I'm probably the only one that's willing to see a Lyme patient more than once, because the party line continues that, according to Infectious Disease Society of America, Lyme is easy to diagnose, easy to treat, and 2 weeks of antibiotics and everybody is cured. And that was really clear that wasn't the case for me. So I kind of took a stand on that, and I've been paying the price ever since, I would say. Well liked by my patients, but totally detested by most of my colleagues,
God bless you. And I think that's why I wanted to talk to you, is because I was just listening to a little bit of your tick boot camp, and I was like, ooh, he's a rebel like myself, right? Like willing to stand out there, willing to put your neck out there and talk about these hard things, but there's so many sad people suffering, falling through the cracks because of the insanity. And I guess it's good to know that it's worldwide. It's not just the United States that has that same belief on Lyme disease. So God bless you for doing the work you're doing.
Well, thank you. No, absolutely. And you know, the mantra is I'm a member of Infectious Disease Society of America, which is 15,000 strong. And they've just basically ganged up on anybody who doesn't go along with them. And they're a pretty powerful group. But then again, I mean, David versus Goliath, Ukraine versus Russia. I think you kind of have to stand up when you know what you're doing is right, even if it's against odds. And I think that's really the challenge. Is I think that there is compelling data that Lyme is not simple, not easy to diagnose, not easy to treat, and Lyme can persist for years and years. There's lots of clinical evidence about that that's been buried in the medical literature, and IDSA has just basically, swept it under the carpet. And I'm quite willing to stand up, anytime, because I treat patients, and not all of them, but I would say 70% of them improve or get better with my treatments, which are not the standard 2 weeks of antibiotics. So I stand by what I do because I see, in most cases, it's making patients better, and that's what medicine is all about. That's why we should all get into medicine.
Oh my gosh. I'm just going to love this episode so much. I already am. Like, I'm all fired up, because, yeah, I mean, 27 years of undiagnosed Lyme disease I had, and it wasn't until this last year that the CDC actually recognized chronic Lyme disease as a real disease. So my whole life being gaslit by the medical community, nobody believing me, right? Telling me it was all in my head. You've heard it 150,000 times, I'm sure, because my story's not special, right? It's actually very common.
It absolutely is, and the challenge is, like I said, it's in Ireland and the UK, they say it's a rare disease, but they don't keep track of it. So how do they know? And then recently, we've seen, as you mentioned, we now see COVID has affected so many people, and long COVID has affected so many people, and we've learned a huge amount about chronic Lyme from all the money that's going into long COVID. No money goes into researching chronic Lyme, but the money that's gone into long COVID really has benefited, I think, the Lyme community, because we understand so much better the pathogenesis of these conditions. But then again, so many of the long COVID patients are getting gaslighted and told you're just anxious. And you've just got chronic fatigue, or you're malingering. So unfortunately, so many people with chronic, long COVID are going through the same experience that patients with chronic Lyme have gone through for years and years, the gaslighting phenomena.
Absolutely. And I don't wish it upon my worst enemy. And at the same time, if it takes something else to kind of help raise awareness, like, thank God, right? So what is I kind of lost my train of thought there, which never happens. I love what you're dropping into. So how long have you been working with the Lyme world?
So probably just in the last 10 years, I started kind of, committing to doing it. I mean, I would see random Lyme patients. I'm a general infectious disease doctor, so I see tuberculosis, HIV, hepatitis, all infectious diseases. But I guess just 10 years ago, I started to realize that a lot of patients, were not getting better. And with the standard treatment for Lyme disease, so I kind of took an interest in that. So I've really been doing it for the last 10 years, and seeing these patients and following these patients for longer, longer term, and treating them with longer course treatment, which is against the guidelines. But as I say, guidelines are guidelines, and if I have a patient in the ICU, with sepsis, and the guidelines say treat for 7 days, if they're still septic after 7 days, you know what I do? I am controversial. I treat for 14 days. I treat for 21 days, and they live. But if I stop treatment at 7 days, they die. It's not quite the same with Lyme disease. You don't die quickly, but you die slowly. And people argue that you can't treat for longer than 2 weeks because the guidelines say so. But every infectious disease needs to be treated individually. And it's a paradox to me why Lyme disease is different. So I treat people with Lyme disease, and sometimes they have other infections besides Lyme disease for longer. And the issue is, if you've got longer standing infection, it's not just the infection, it's the immune system. So you have to deal with the problems of the immune system and the inflammation that's been generated. So I guess I've become more of a holistic physician, because it's not just the infection. You need to target the immune system. You need to target the inflammation. But then that's no different than long COVID now. Now we see long COVID. It's an infectious process that propagates brain inflammation, immune dysregulation, reactivation of viruses, mitochondrial crashing, and probably the concept of microclots, lack of blood supply going to parts of the body from microclots. So I just think that and when I look back at my Lyme patients now, I say probably some of those same processes that we're now discovering in long COVID are going on with Lyme patients. We kind of thought about it, that might be going on, but now there's a lot of science coming out in long COVID that I think we can extrapolate to, chronic tick-borne infections, Lyme, Bartonella, Anaplasma. There's a whole bunch of infections that ticks carry, not just Lyme.
Oh, amen. So yeah, I'm a practitioner after my own heart. That's why I am a functional coach, because it's never just Lyme disease, right? And so many folks who get this disease, they just want to focus on the treatment. They just want to focus on the treatment. But those that get better and stay better, right, are the ones that are incorporating, lowering inflammation, getting their lifestyle, are you pooping daily, detoxing, looking at the whole picture. So thank God you're a holistic physician, because that's definitely needed more and more these days. Because if it's not Lyme, if it's not COVID, it's going to be the next boogeyman that comes around the corner. And we need to get our immune systems nice and robust and healthy. And
Right. And I think, interestingly, when I first started treating Lyme patients, I just treated them with antibiotics and I got them better. And when I stopped the antibiotics, they went backwards. And it was actually my patients that taught me. They'd come along and say, I'm taking these supplements, I'm taking ashwagandha, I'm taking, these vitamins, I'm taking all these other regimes. And that's the thing on top of the antibiotics that got me over the hump and got me better and kept me better. And I long time ago, back in the day of HIV and AIDS, there were studies looking at LDN, low-dose naltrexone, which has anti-inflammatory immune modulating effects. So I started adding in, LDN and these kind of products. But it was actually just my observation of treating patients, getting them better, and then when you stop the antibiotics, seeing them get worse. And I guess the best analogy I could use is that it's not just antibiotics that kill off bacteria. You need to have a healthy immune system. And if you go back to the day of HIV and AIDS, when we didn't have any treatment, you treat a patient with HIV and AIDS for an infection, it would get better. And when you stop the treatment, guess what? A month later, the exact same infection would come back again. So you never actually knocked the infection out. You just actually knocked it down. And when HIV treatments came along to actually get the lymphocytes, which are damaged by HIV, go back to normal, your CD4 lymphocytes, your helper cells, when they went back to normal, next time you treated that infection, the infection stayed away, because it wasn't just the antibiotics or anti-infectives that were getting people better. It was a healthy immune system. So there's lessons to be learned from other, immunocompromised, conditions, HIV being one of them.
Fascinating. Hey, this is a great spot. We're going to pause real quick for a commercial. Don't go anywhere, because when we come back, we're going to dive deeper into, what is chronic Lyme and how it could be tied to long haulers, and, some tips and tricks that could help, overcome to spot this and things to help get better. So don't go anywhere. We'll be right back. Hey there. I used to not be able to drink coffee. I always reacted to it horribly. It hurt my stomach. It made me over jittery and would inflame me and cause histamine issues. But not anymore. Not that since I started drinking Danger Coffee by Dave Asprey. It's his next level of coffees. He came out with Bulletproof, And now this is the next level up. So it is mold-free, toxin-free, and he infuses it with minerals and electrolytes. So unlike other coffees, they can actually pull minerals and electrolytes from your system because it's too acidic. It actually helps replenish those. And so I don't react to it at all. I get to have my bulletproof coffee with my MCC oil and my grass-fed butter, and I don't get the jitters, I don't get the crashes, and I love how focused and energized it makes me feel. Again, non-toxic, mold-free, infused with minerals and electrolytes. I absolutely love Danger Coffee. Make sure to check out my website, thelymeBoss.com. Go to the resource section and get yours. Awesome. Welcome back. Oh my gosh, I was so excited this first half. I'm even more excited to dive in deeper. So we're here with Dr. Lambert, a infectious disease doctor out of Dublin, Ireland. And how much fun. I love the internet, bringing people from clear across the continent together like this, sharing the wisdom and the awareness and the education and inspiring others. So let's dive deeper into chronic Lyme, long haulers, all this fun stuff.
Mhm. Okay, well, I give a lot of lectures on comparing chronic Lyme to long COVID, and if you actually look at the brain scans of both of those of both groups, specifically if you look at PET scans, the PET scans are scans that show up things sometimes that when regular CT scans and MRIs don't show up. But if you look at the PET scan studies that have been done on chronic Lyme, and you look at the PET scans that have been done on long COVID, what you see is hypoperfusion defects in the posterior part of the brain, and that's the part of the brain where the cerebellum, the pons medulla, the geniculate ganglion, the nerves coming out of the brain, the nerves that come out of the brain, the autonomic, sympathetic, parasympathetic system, the vagus nerve, the pain centers in the posterior part of the brain, the respiratory centers in the posterior part of the brain. And when you actually look at your patients with chronic Lyme, they have these random pains, and they're actually being triggered centrally. They're central in many situations. The pain is being triggered from the brain. It's not necessarily in the joint itself. It's not, because it moves from place to place. If you've got arthritis, it's usually continuously in one location. If you look at the respiratory centers in the brain, a lot of patients with Lyme and a lot of patients with long COVID have this air hunger. This air hunger, sometimes it's a central process. And when you actually treat the brain inflammation, the air hunger disappears. When you treat the brain inflammation, the pain syndromes disappear. So I guess that first off, I think we've learned a lot by comparing, chronic Lyme to long COVID. And if you look at the radiographic findings, they're very similar. If you look at the dysautonomia, they're very similar. If you look at, a lot of the other features of these conditions, they're more similar than they are different. Now, the chronic Lyme community have always said, I have viruses in my body as well. But we've never been able to prove it in chronic Lyme. But when you get to long COVID, people have done studies now, and they've for example, we did a study in our hospital with patients with acute COVID who ended up in the ICU or the HTU, and about 10% of them were getting outbreaks of shingles, outbreaks of herpes. We actually did blood cultures, PCRs, and they were getting reactivation of CMV. They were getting reactivation of EBV because COVID was knocking down their immune system, and they were getting reactivation of all these endogenous herpes viruses. And these are the same kind of processes I think are happening in patients with Lyme. I follow up chronic Lyme patients. I follow up, long COVID patients. And, very often all the bloods are normal, but sometimes I do lymphocyte markers, and there's CD4 counts, which are the T helper cells that are damaged in the setting of HIV. Very often my patients have CD4 counts in the 200, 300 range, which is very similar to a patient with HIV. So, these patients are immunocompromised. Patients with long COVID, patients with chronic Lyme, they're immunocompromised. They have an infection, but that infection has triggered an immunocompromised condition, and there's a whole cascade of processes going on, leading to inflammation, leading to mitochondrial damage. It's actually a fascinating, disease when you try to understand it. I think most doctors are turned off by patients with chronic fatigue syndrome, ME, fibromyalgia, but those are not, I always get back to the point, those are labels. If you step back, what causes people who are previously well to hurt all over? And rheumatologists seem happy calling it, fibromyalgia, but that's not a diagnosis. That's just a description of that they have pain. Neurologists, when they can't figure it out, want to call it FND, functional neurological disorder. That's not a diagnosis. That's just a bloody term that makes them feel good, but I don't think it does anything to help the patient. So I'm not really into labels. I think it's absolutely great that we have an opportunity to come up with pathogenetic understandings for what's going on, and then potentially, opportunities to intervene. We did a study with our COVID patients, looking at the microbiome, and their gut is destroyed by COVID, and your immune cells, 80% of your immune system is in your gut. So every patient that I take care of, Lyme, long COVID, they go on probiotics, they go on kefir. I'm not a dietitian, so I'm not really good at giving them great advice on nutrition, but you need to deal with the gut as part of the solution. And I've kind of learned that the hard way, but I think it's absolutely great that we now have some science coming out to support. I'm not a functional medicine doctor, but I do think that we really do need to look more than just the infection and the antibiotics to treat that infection.
Oh my gosh, that's a mic drop moment. Absolutely. That's what I've been screaming at the top of the mountain for years, and people think I'm insane, but anywho, that's a whole nother story. I'm going to ask you something that if you want to talk, it's a little controversial, but I actually have never asked anybody their thoughts on this before. So you'd be the first. And if you don't want to answer, totally okay. But vaccines, what are your thoughts on like the new Lyme vaccine that's coming out, and even the corona, virus vaccine and all the boosters? Like, what have you seen?
Right. Well, first off, let's talk about coronavirus vaccines first. In the first wave, when young people were ended up in the ICU, very sick, I was the first to stand up and take an mRNA vaccine in my hospital because I saw a lot of my consultant friends, a lot of nurses ending up in the intensive care unit. But as the virus is mutated to be kind of less virulent, it's much more contagious, but much less virulent. I mean, these mRNA vaccines are preventing severe disease, but they're not preventing infection. And people don't get severe disease anymore. And my observation is that I've seen an awful lot of patients with chronic disease or long COVID or Lyme who get the vaccines, and they have kind of worsening of symptoms that last for a really long period of time. So I think the risk balance ratio now is I wouldn't take a COVID vaccine anymore, because I just think they were rushed through very quickly. I think they had utility a few years ago, but I think until we have new generation vaccines that are preventive vaccines, I'm not going with that. Also, a lot of my HIV patients are being called in. They're not particularly immunocompromised, but they're being offered a vaccine every 4 months, 5 months, and I think that's a bad idea. So that some of them have 7, 8 vaccines now already, and I think that's quite risky. I think there's lots of scientific reasons to question, whether that's a good strategy. So I'm not sure that the current mRNA vaccines and adenovirus vectored vaccines, I've done a lot of work in vaccines. I used to be at Hopkins in the Center for Immunization Research. I've done a lot of work in that, and I'm totally pro-vaccines as a rule. But I think it's quite risky at this stage. So that's my opinion on, COVID-19 vaccines. I think when we have preventive vaccines, maybe that'll be a better opportunity. moving on to the Lyme vaccines, there were 2 Lyme vaccines that were licensed, back in the, I think it was the 90s. I was actually on the data safety monitoring board for one of them when I was at Hopkins. So, but these 2 vaccines that were licensed were taken off the market. And some people say it was just because there wasn't good uptake. Some people say it was because they were so reactogenic. So if you'd already had Lyme disease and you got the Lyme vaccine, you could have a bad reaction. But it's not really clear to me why these vaccines were taken off the market. And there is a new Lyme vaccine that's in clinical trials right now in the European Union, but the studies have been delayed, and I don't know why they've been delayed. So I think Lyme is a very complex immunopathogenic disease, and I think it's quite complicated to design a vaccine that can be safely given. So I'm a bit skeptical about whether we're going to come up with a Lyme vaccine that is going to really do the job. The current vaccine also that's in clinical trials right now, I think you need 3 doses of it. And, I think, I think it's a huge challenge. Like I said, I'm pro-vaccine as a rule, but I also have my reservations about whether, it would be great if we got a vaccine that was safe and was preventive and had minimal side effects, but I'm a bit skeptical. I'm skeptical about lots of things.
That totally makes sense. That was a beautiful answer. Thank you. And so you had talked about, one thing that you needed to look into if you've got long haulers or, long chronic Lyme is looking at the gut. What are some other areas of interest that people need to focus on if they want to get better?
Right. Well, I think one of the things that we've learned that I've learned from long COVID is this whole concept of pacing, people crashing so easily. All my patients with chronic Lyme, all my patients with long COVID, they push beyond a certain limit and they have this PEM, the post-exertional malaise. And there's a lot of evidence now that there's, this is mitochondrial and they crash. And people, until recently, an awful lot of physiotherapists in Ireland and the UK, I can speak of it because it was pulmonary. The pulmonary physicians were the ones who led the long COVID clinics, and their pulmonary physiotherapist says, rah, exercise, exercise, exercise more. If you exercise more, you crash and you're in bed for a month. And so I think, I've actually learned a lot about the mitochondria from managing long COVID patients and applying it to my chronic Lyme patients. So, so repairing the mitochondria really seems to be an important concept. It's clear that the mitochondria is damaged with COVID and long COVID, and it must be with Lyme and chronic Lyme and the co-infections as well. So I think, like I said, I think I'm paying a lot more attention to mitochondrial repair. There's glutathione, N-acetylcysteine. There's a herbal product. I work with Napier's the herbalist in Scotland, which is a group of herbalists that give me advice because, they kind of have adopted the Buhner protocol for Lyme patients, and so I think. Before 1945, herbalists managed infections. Herbalists managed a lot of things, and they've taught me a lot. Mangiferin is a product that they use. Comes from mango extract that helps with the mitochondria, helps with other things. So I've kind of learned from herbalists on things that I could add in to support patients in addition to the antibiotics that I can contribute, because I'm an infectious disease physician. I manage the most complex infections, I would say, really in the world, but I don't think there's anything more complex than chronic Lyme.
110%. I can attest to that. It's funny, when I got back into business as a functional practitioner, I wasn't working with Lyme in the beginning, and people were like, "Why aren't you working with Lyme? Isn't that your story?" And I'm like, "Have you met people with Lyme? Like, it is." Once you work with Lyme, then you got to learn about co-infections. Now you got to learn about PANS and PANDAS. Now you got to learn about SIRS and mold, because it's all interconnected and it's so complex. Yeah. So yeah. Herbs, love herbs, huge fan of herbs. So we got time for about one more. What's like another good nugget that you could drop on people if they're, looking to get better?
Right. Well, that's a tough one. That's a tough one. I just think that, that patients with these conditions are in a really difficult position because the medical community is not supportive. This is the challenge, and I just think that, I think my patients have found a lot of support from patient groups, and I feel that I'm in the minority, in terms of treating patients with Lyme. There's a group called the Infectious Disease Society of Ireland. There's 28 of them, and there's one of me, and there's 27 of them. And like I said, that if I listened to them or I went along with them, I think I wouldn't do that just because I'm not going to be bullied into practicing bad medicine, as far as that goes. But I think there's very few doctors are willing to go into this field because you do face a lot of flack. But there's nothing more rewarding than seeing somebody in a wheelchair, 2 months on antibiotics, being told for 2 years that they've got a functional neurological disease, being sent to psychiatrists, get out of the wheelchair. And, because 2 years ago they had a tick bite and they had Lyme disease, and antibiotics cure Lyme disease. So I think Lyme is curable. It's not easily curable, especially if you had it for a long time, but Lyme is a bacteria. And if you treat people with the right combination of antibiotics and the right supplements and the right support, you can cure that infection. And I think that's the message to get out there to people. And don't listen to, the GPs who are tired of seeing you come visit them 10 times, and say all your tests are normal. Just because the tests are normal, maybe they haven't designed the right test to diagnose your condition. So I think it's important to hang in there and look for the right people who are going to support you.
110%. Like, I don't think I've ever said it so many times, and I'm like, can I get an amen? So where can people find you if they want to learn more about you or how to work with you?
Right. So I work in Ireland. So I have a website. It's just iddoctor.eu. So www.iddoctor.eu. And I see patients, mostly in the European Union. I only see patients in person. I don't believe in doing Zoom medicine. Because I need to examine patients. I need to be there with them. But I see patients from all throughout the European Union, and I occasionally see people from elsewhere. So whether it's chronic Lyme, co-infections, long COVID, I'm quite committed to working with people, even those that don't get better quickly, because I don't think you should give up on people.
Absolutely, 110%. And yeah, don't give up. Like that's the one thing you heard through this whole thing. Don't give up. There is hope. Yeah. And there are amazing people out there like him, like myself, who are saying, it's possible. Don't give up. So the 20 people that you've already seen before, what a great lesson. You learned what didn't work, right? Keep digging. Don't give up. Thank you, Dr. Lambert, for joining me today. I so appreciate you and everything that you're doing. Make sure everybody else to have a healthy day. If you learned anything, even one little nugget in any episode, please do not keep us a secret. Like, share, subscribe, and leave a review on Apple, on Spotify. That is how we get this information out there, and we change this paradigm one person at a time. I can't do it by myself. I need your help. Also, make sure to know that disclaimer, anything that you hear on this, you cannot hold Discovering Health LLC, Renegade Health Boss, the Lyme Boss, Heather Gray, liable for anything. Always consult your doctor before doing anything new. Do not take this as medical advice. This is your disclaimer. And then also, if you want to know the foundations of health, right? All that I talk about on how I get healthy, the absolute foundation, sleep, diet, exercise, what to eat, toxins, how to detox mold, all of it. You can get it in your own course at rhbcourses.com, right? Start your healing journey today as little as $79. Start today, rhbcourses.com. Stay tuned and thanks for joining us.